The HHCGA's mission is to work throughout the state of Georgia, the region, and in certain circumstances throughout the United States. Our mission is to be on the forefront of anything in chronic diseases in education, policy, advocacy, and how we can better uplift our Hispanic Latino population and partner with other populations so that we have better health outcomes.
The University of Georgia College of Pharmacy offers many opportunities to their students to engage with underserved populations throughout the state of Georgia. We have 4 distinct campuses, and through involvement with our student organizations as well as our introductory professional practice experience and advanced practice experience, we are all throughout Georgia, from Columbus to Savannah, everywhere, all year.
The CDC recently found that about 15% of the Hispanic community tend to be in poor or fair health. So pharmacists are really at the forefront to help correct that and make sure that the Hispanic community is receiving the care that they need. The University of Georgia really wants to make sure that they're reaching out to the community around them. So what we've been trying to do recently is we're trying to extend that arm, and we're trying to go to different areas of Georgia to see if we can promote health and making healthier choices in all parts of Georgia where there's any kind of Hispanic community.
The advantages for students to be embedded into the field with the Hispanic Health Coalition and all of our other partners is because they see a horizontal perspective of what really does happen in the community. What are the needs in the community? What are the health assessments of the community? What are future needs so that there's sustainability and building of needs that may not have been thought of before, that they may not learn in a curriculum environment.
So Georgia makes sure to send out their student pharmacists to teach these patients, and also it helps us as a school learn about the community and the subtle nuances that wouldn't otherwise be picked up if you hadn't worked with them otherwise in the past.
I've noticed that some communities are looking now more for resources because they realize that there are people that are out there that are willing to help them. It just depends. They have to know the right people. So if we get to meet someone and we meet a partner, we become partners with them, they tell somebody about us, they get our information, we get their information, and we get to get some resources to them.
People don't know. How do you fix something if you don't know what the issue is, right? People don't know that they're having these issues. People don't know that there are resources available to them. There are many reasons of why people are unaware of all the resources, but I think the main thing is they're not looking for them.
Primero que todo, y siento que como nos ha funcionado, es escucharlos, escuchar a las personas y escuchar a la comunidad para poder llegar y cubrir todas esas falencias que existen y realmente conectarlos con la información que tenemos y los recursos también que hacemos.
It is imperative for stakeholders to know their role in the position because we're multi-generational and because we need to build better health outcomes for future generations. It's important to take people with different subject matter expertise across the state, bring them together, place a web together so that we can have best outreach, best outcomes, best advocacy, and best policy that reaches all.